If low sperm motility causes has made you feel embarrassed, broken, or confused, pause here before you blame yourself. This is not about shame or miracle promises. It is about clear information, better questions, and the next responsible step. If one result has been sitting heavily in your mind, let this video slow the fear down and turn it into a more responsible next step. Before we go deeper, comment questions if you are watching this because you want to be more prepared before speaking with a clinician. Let us make low sperm motility causes practical. If you have an appointment coming up, do not walk in with only anxiety. Walk in with information, dates, and questions. This video is educational and not medical advice. Use it to prepare better questions for a urologist, reproductive endocrinologist, fertility clinic, or qualified clinician. Before the visit, write down how long you have been trying, whether pregnancy has happened before, any miscarriages, how often intercourse happens around the fertile window, and whether either partner has already had testing. Stay with me here because this next distinction can save you from months of guessing, panic buying, or blaming the wrong thing. Bring the full semen analysis report if you have one. Do not rely only on memory. The details matter: volume, concentration, motility, morphology, total count, total motile count, pH, viscosity, and any lab comments. Write down medical history that may matter: past groin surgery, undescended testicle, infections, fever, chemotherapy, radiation, anabolic steroids, testosterone therapy, pelvic injury, diabetes, varicocele, medications, smoking, vaping, alcohol, heat exposure, and sleep problems can all be relevant questions. Ask direct questions. What is the most likely explanation? Should the semen analysis be repeated? Do I need hormone blood work? Should I see a reproductive urologist? Are IUI, IVF, or ICSI relevant? What should we do during the next 90 days? The goal is not to become your own doctor. The goal is to stop being passive in a process that affects your future family. Comment the word questions if you want a deeper follow-up on this topic, because your comment tells me which part of this conversation needs a full next video. Let us slow this topic down because fertility content can easily become overwhelming. When a man hears something about low sperm motility causes, he may immediately think about failure, age, masculinity, money, pressure from family, or fear of disappointing his partner. Those feelings are real, but they are not a medical plan. The first step is to separate emotion from information. Emotion says, what if this means everything is ruined? Information asks, what do we know, what do we not know, and what should be checked next? That shift alone can reduce panic. A responsible fertility conversation usually starts with proper testing and context. A semen analysis may include volume, concentration, count, motility, morphology, and sometimes other lab notes. But one result should be interpreted with timing, health history, abstinence period, illness, medication, heat exposure, and the partner's fertility picture. If you have ever felt confused by fertility terms, drop a checkmark in the comments. You are not alone, and confusion is exactly why we slow the topic down. The next mistake to avoid is treating online advice as a diagnosis. A video can educate you, but it cannot examine you, review your full history, repeat your test, check hormones, or decide whether a reproductive urologist is needed. Use this content to become prepared, not to replace care. If low sperm motility causes connects to lifestyle, think in realistic terms: sleep, smoking, vaping, alcohol, heat exposure, medications, testosterone use, weight changes, stress, and illness may matter for some men. But lifestyle is not the only possible factor, and blaming yourself for everything is not useful. If low sperm motility causes connects to test results, ask better questions. Which number is most important for our situation? Should this test be repeated? Is there a possible hormone issue? Could varicocele, infection, medication, or prior surgery be involved? Should I see a reproductive urologist? What is the next decision point? If you are in a relationship, bring your partner into the conversation with care. You can say, I am nervous, but I want us to face this together. That sentence can prevent silence from becoming distance. Fertility pressure is heavy enough without both people feeling alone. Be careful with miracle promises. Any claim that guarantees pregnancy, fixes every sperm issue quickly, or tells you to ignore medical testing should make you pause. Good fertility information should make you calmer, clearer, and more prepared. Your action step today is to gather your information. Write down your timeline, test dates, medications, health changes, and questions. Put them in one note before your appointment. Prepared questions can turn a stressful visit into a useful conversation. Let us recap. Low sperm motility causes is not a verdict. It is a topic that needs context, testing, and qualified interpretation. Do not let shame make decisions for you. Let information, partnership, and proper medical guidance lead the next step. Now let us go deeper into how to think clearly when emotions are high. Fertility conversations can create pressure because they involve time, money, intimacy, family expectations, and identity. If low sperm motility causes feels heavy, that does not mean you are weak. It means the topic matters. A helpful way to organize the journey is to divide it into 4 boxes: testing, causes, options, and communication. Testing tells you what is known. Causes explore why it may be happening. Options show what can be done. Communication protects the relationship while decisions are being made. In the testing box, do not rely on summaries alone. Ask for the actual report. Learn the words slowly. Count, concentration, motility, morphology, volume, total motile count, hormones, and timing can all mean different things depending on the situation. Participation moment. Comment, report if you are going to keep your test results organized instead of trying to remember everything from stress. That one habit can make appointments much more useful. In the causes box, stay humble. Sometimes the cause is obvious, sometimes it is not. Heat, illness, medications, hormone issues, varicocele, prior surgery, infections, lifestyle factors, and unknown factors can all enter the conversation. Guessing is less useful than checking. In the options box, avoid jumping to conclusions. Some couples may be advised to repeat testing, some may discuss lifestyle changes, some may need medication review, hormone evaluation, reproductive urology, IUI, IVF, ICSI, or another plan. The right option depends on the full picture. In the communication box, do not disappear. Many men cope by going silent, but silence can make a partner feel alone. You do not have to have perfect words. Try saying, "I am scared, but I want to stay involved and face this with you." Let us correct another common mistake. Fertility is not only about the female partner, and it is not only about the male partner. It is a couple-level process. Testing both sides is not blame, it is information. If low sperm motility causes connects to semen analysis, remember that one test may not tell the whole story. Ask whether it should be repeated and how to prepare correctly. Follow clinic instructions about abstinence period and sample collection because details can affect interpretation. If low sperm motility causes connects to lifestyle, choose realistic changes. Sleep better when possible. Avoid repeated heat exposure if relevant. Discuss medications with a clinician. Reduce smoking or vaping if relevant. But do not punish yourself with extreme plans that you cannot sustain. Checkpoint. If this is helping you feel calmer, drop the word clear in the comments. The goal here is clarity, not fear. Clear men ask better questions. Clear couples make better decisions. Now write down 3 appointment questions. First, what does this result mean in our situation? Second, what should be repeated or checked next? Third, what timeline should we follow before changing the plan? These questions are simple but powerful. Also ask what not to do. Sometimes avoiding the wrong thing is as important as doing the right thing. Ask whether there are supplements, hormones, heat habits, medications, or delays that could work against your goals. If shame shows up, speak to it directly. Say, "This is health information, not a verdict on my worth. I can be responsible without attacking myself. I can be involved without pretending I am not scared." The big takeaway is this. Low sperm motility causes should lead you toward better questions, better testing, better teamwork, and qualified guidance. It should not push you into panic, secrecy, or miracle claims. Before we close, let us turn this into a calm action plan. Step 1. Write down what you know about low sperm motility causes. Step 2. Write down what you do not know yet. Step 3. Write down who can help you interpret it properly. That may be a urologist, reproductive urologist, fertility clinic, or qualified clinician. Do not make a permanent conclusion from temporary fear. Fertility journeys often involve waiting, repeating tests, comparing options, and making decisions as a couple. The strongest version of you is not the version that pretends not to care. It is the version that stays present and informed. If you are watching with your partner, pause after this video and ask one gentle question. What part of this journey has been hardest for you? Then listen without defending, correcting, or rushing. Fertility pressure becomes lighter when both people feel less alone. Comment next step if this helped you move from panic to a plan. That tells me to create more videos that turn confusing fertility topics into clear, responsible questions. Remember these 3 steps before you leave. Know what you have, know what you still need, and know who can guide you. That is how you move forward with more confidence and less fear. You do not need to carry this topic in silence. You need information, partnership, and the courage to ask the next responsible question. Before you go, comment next step if this helped you turn low sperm motility causes from fear into a clearer question for your doctor. If this made male fertility feel less confusing and more manageable, subscribe to Fertile Man and press the notification bell. The next videos will help you understand testing, hormones, sperm health, doctor questions, and the decisions men are often too embarrassed to ask about. Share this with a man or couple who needs clarity without shame. Subscribe